Hi, everybody. Welcome back to my YouTube channel and my series on menopause, hormone therapy. Today, we're going to be talking about something really juicy. We're going to be talking about libido. What is it? And all the things that can affect it. And how do we go about thinking about it? If we want to improve our libido, what can we do about it? All those fun topics. So this is more like a chat, although I am talking out into the abyss. Hopefully there are many of you who will listen and comment and ask questions because this is a topic that is really not talked about. Didn't learn barely anything about it in medical school. I'm an OB-GYN. Barely learned about it in residency. But, over time, I've gone to conferences and read up on different things. I became a menopause certified practitioner through the Menopause Society to learn more about our bodies, about menopause, perimenopause, hormone therapy. And we're just scratching the surface on libido. And yet, this is such an important topic and something that we feel a lot of shame around, not just patients and women, even doctors, because again, nobody really taught us anything about it, and it is not talked about. And I think most doctors don't ever ask their patients about libido, and studies have shown that patients actually want to talk about it at their doctor's office, but don't want to bring it up themselves. Like, they want somebody to ask them, and then they're happy to talk more about it and get some help. But this is something that we really need to normalize. There's so many social, cultural factors. I mean, trust me, it's a little awkward for me just even talking about it as a brown woman, a brown doctor. And so, but I don't want this to be a place of shame. I want this to be a place where we really, embrace this and learn from each other and actually take tangible steps to have a more fun life, and a fulfilling one. Okay, so let's start with what is libido? Libido is sexual desire. It is the desire to feel connected with yourself, with your partner. For women, this is just not about sex, okay? There are memes online that show like a man washing dishes, right? And the line is something about like, this is the best type of foreplay or something like that, right? So libido is not just about sex, and for women, desire is so much more. It's about intimacy. It's being feeling connected. It's feeling safe, feeling emotionally connected, not just physically connected. It's having a good self-image, and it all of these things go into desire. And it's not like an on-off switch, right? Like, oh, my libido was high one day and it's low one day, or it's high in the morning and low in the evening. It's kind of like a dimmer. I love that analogy. Libido and sexual desire is like a dimmer, and there are many things that can amp it up, and there are many things that can take it down. And no 2 days are the same. No 2 moments in a day are the same. So it's very complex. Libido is so complex. And we, again, as I said, we are just scratching the surface. And I'm really excited about all the research that is going to come out this decade about libido and sexual desire, especially as it pertains to women and this time of our lives, which is, perimenopause and menopause. So let's dive in a little bit more. So let's talk about, why libido drops. We talked a little bit about what it is, but why does libido drop? Why does our desire drop at various points of our lives? And there are many, many factors for this. So number one, hormonal status can definitely play a role. So a drop in estrogen, a drop in testosterone, which, by the way, is not just a male hormone. Women have plenty of testosterone, and changes in this can definitely affect libido and desire. There can be physical causes that affect your desire. So if you are in pain, or you have, maybe you have hip pain, maybe you're needing to take pain meds all the time. Maybe you have other medical conditions that are happening that, like desire and libido is the last thing you want to think about. Maybe you have physical conditions like vaginal dryness and pain. Okay, if you're having that, like you definitely don't want to be having penetrative intercourse, for example. Even though you may have the desire, like you still that it may prevent you from really enjoying that part of your life. And if that's the case, please watch my previous video on types of hormone therapy and vaginal estrogen. So we've got hormones, medical, physical causes. There can be medications. Maybe you started a medication. Birth control, by the way, is something that can actually drop libido. There are certain antidepressants that can do this. So if you're noticing a change, like just take inventory and stock of what's been happening in your life, and what did you add any medications. And then there can also be other psychological, physiological, and cultural factors too. Maybe you have a history of trauma, or sexual trauma, and you have PTSD, and that can definitely affect desire, or in cultural differences, ethnicity, and how you were raised, in your family, religious differences. All of these things can play a role in libido and desire. So it's not a very simple thing. Here, let's test this and see why you have low libido. It's a very complex thing. And if you're somebody who is sort of having desire that goes up and down, really take a minute to think about all these different things. What is your lifestyle like? Did did something happen recently? Are you more sedentary? Are you more stressed? Are you working more? Did you start new medications? Are there other physical things going on? Are there other psychological old traumas that are coming up? And then also relational, right? Like, what is your relationship with yourself? Are you a happy person? Are you happy with yourself? What is your relationship with your spouse like? And all of these things can just layer in to this whole idea of libido and sexual desire. So I want us just to appreciate for a second how complex it is. Okay. All right. So we've talked about what is libido, what are all the things that can affect it. Let's talk about what is normal. Okay. Patients ask me all the time. What is normal? How many times should I be having sex? Right. So first of all, I just laugh because first of all, we know that, libido is not just about having sex, right? It's about connection. I'm talking to women. So especially for women, it's about connection and feeling safe and all these things. Desire is just so encompassing. There's no right or wrong answer about how many times you should be having sex or how many times you should be, intimate per month. There's polls that are done, nationally, all over the world. And it's just interesting to see the answers. But there's no one size fits all. There's no right or wrong answer. It's really about what you're happy with. There are some people who are married and who literally never have sex. And they're like, you know what? Cool. It's fine. We travel, we go to eat, we're cozy, we cuddle, but that's about it. We don't really need to do anything more. And they're happy with that. And that's kind of their level of desire, and that's what feels normal to them. For other people, though, they do get very concerned. Like, they want to be a little bit more connected. They want to do more, but they're not able to. So this is when it's actually a problem. If it's really a problem for you, not for society, not for your friends, not for, what social media tells you should be doing, or, the latest movie or whatever. It's really a problem if it's a problem for you. So that's really the bottom line when it comes to, all things sexual, in terms of is it normal or not? Again, there's no standard, there's no right or wrong. If you're happy with your level of desire, great. If you're not happy with your level of desire, then let's talk about it and let's see what we can do about it. Okay. So hopefully that's helped, given us a good framework of how to start thinking about libido and desire. Okay. So what can you do about low libido? So if you're somebody who has a low amount of desire, but you want to have more, so you're like, okay, this is a problem, and let me start to troubleshoot it. What can you do? The first thing is take stock of your physical health. Okay. So see your doctor, get a bunch of labs, check your cholesterol, check your sugar levels, your diabetes screen. What is your blood pressure like? Are you in a healthy weight? Are you eating well? Like, what kinds of foods are you eating? There are foods that can just kind of dampen your mood and they're going to put you to sleep, versus other foods that are more energizing and vitalizing. So you want to see what your lifestyle is like, and also rule out physical causes. So do you have metabolic issues? Do you have gynecologic issues? Please see your GYN, get a good exam. Do you have other vulvar conditions that you've never known because you haven't looked? Maybe you have lichen sclerosis or lichen planus, and maybe you itch all the time and you're like, oh, it's just that's just normal for me. Well, maybe it's not. Maybe you have an actual condition that can be treated. Maybe you have vaginal pain. Is it because of dryness, or again, is it because of some other vulvar, condition? So you want an exam, and you want to just rule out physical causes as the first thing. And then you also want to optimize your hormonal health. So where are you in that whole spectrum of perimenopause and menopause? Is your estrogen starting to dip a little bit? What are your levels? Maybe you want to get a blood test to see where you're at, and also kind of take stock of other symptoms. Are you going through other menopausal symptoms? Make a list. Go speak to a gynecologist, and maybe you need to be on a little estrogen and progesterone to kind of optimize that part of your health. Because we know that sometimes in menopause, when estrogen and progesterone drops, people don't really have a lot of desire. And we can certainly reverse this by supplementing and giving back some hormones. So optimize your hormonal health. Now, we actually do have testosterone options as well for women with low desire who are postmenopausal. So we do give testosterone gel, which is an option. So other than estrogen and progesterone, maybe you want to be somebody who is adding a little testosterone. So that can be an option. There are a couple of other FDA-approved medications for women with low desire. For premenopausal patients, there are two. One is a daily pill that you take that kind of increases dopamine, increases that whole pathway, and leads to improved desire. And another is a little injection, actually, that you give yourself. It's a little shot. It's kind of like Viagra that really boosts your libido and desire for the next 10 to 12 hours. I mean, sounds amazing. So for patients, sometimes people will say, oh, I'm going on a special trip. Like, I want to have more desire. I want to be more intimate. And then they'll do this shot because it's kind of a timed thing, and they want to make the best out of that weekend. So there are options out there, right? But it's not just pharmacologic. There are hormones, there are these medications, but you also want to start with other things. So if you have high blood pressure, we know that narrows your arteries all over your body, including your genitals, and that can prevent, blood flow. There are other, pain disorders, as we talked about. So it's a very multifactorial approach. So you want to really look at all of these things. We've also got moisturizers, we've got creams, we've got devices. I mean, there's a lot that we can do for low libido if it's really a problem for you. So I encourage you not to just kind of keep it to yourself or feel, some way about bringing this up to your doctor, or feel ashamed, or feel like they're just going to dismiss you, or feel like it's just part of aging, right? It does not have to be. It does not have to be. We've got options. Some treatments may be at your fingertips, and you're like, oh, this little change, this little one thing can really help me. Yes. So definitely reach out to your gynecologist and make sure that you address this. So I hope this was useful, guys, for you. We talked, things we covered today are, what is libido? We talked about, why libido drops over time and all the factors that can affect it. We also discussed what's normal and what's not, and the definition of normal. And then we talked about how you go about addressing this, physical causes, hormonal causes. A couple of things I forgot to mention. Also, kind of psychological causes as well. Like, so sex therapy and couples counseling can also help, because when your relationship is off, you could be having the best blood flow, down there, but you're not going to really feel close or intimate with your spouse. So working on your relationship, if you desire to be more intimate with your spouse, is also crucial. I also forgot to mention pelvic physical therapy, which is another great option. It kind of goes along with the physical aspect. If you're having pain, and tenderness, in those muscles, in your pelvic muscles, pelvic PT is a great option as well. So we talked about a lot of things with libido and what we can do. So I really encourage you to think about this and take this information, like really process it for your own life, see where you need help, and then go speak to your doctor about it. I'm Dr. Prabakar. I'm a board certified OB-GYN sexual medicine specialist. I practice in the Bay Area in San Francisco. So if you are anywhere in California, I'm licensed in California. So if you're anywhere, northern, southern, San Diego, LA, wherever, I'm happy to do a consult with you in person or via televisit. And let's talk through some of these problems and issues so that you can live a more fulfilling life. And then if you're somewhere not in California, or if you're elsewhere in the world, we can certainly do a coaching call. So please contact our office to set that up. And please tag a friend who can use this information. Like I said, this is not a much talked about issue. People are embarrassed. There's a lot of shame around it. So let's get a little louder on this. Let's, get this information out there and get people the answers they want. Okay. All right, guys, make sure you watch all my other videos in this series about hormone therapy. Please post any questions below, and I'll be happy to answer them. Bye.